Good day. Welcome to this session. I am Dr. Noel Espallardo. I am currently the chair of the Research Committee of the Philippine Academy of Family Physicians and also the chair of the Publications Committee. And in my capacity of the chair's Publication Committee, I'm also currently the editor-in-chief of the Filipino Family Physician Journal. So welcome to this session. This session is Introduction to Clinical Research. I hope that after this session, you'll be able to conduct your research project as a requirement for graduation to residency, and hopefully in the future publish them so that you'll be a diplomate or a fellow of the academy. Now, this is the outline of my presentation. I will be first defining what is clinical research and why do we do it, and then I will be focusing on the steps in planning to conduct a clinical research. And in this planning, most of my slides will be on the different types of study designs. I will also try to discuss some issues regarding the methodology, especially the studies population, and of course some variables and the data collection and the layout of the analysis as I discuss each of the study design. And then lastly, some ethical issues when we conduct research. Okay, so I hope this is going to be a learning experience for everyone. This is the first slide, no? Definition of clinical research. Research is basically a systematic process to determine the etiology, pathophysiology, diagnosis, therapy, and prognosis of a particular disease. It usually involves a study of a particular person or a group of persons, or materials from humans, such as their tissues. And the design can be epidemiological. It can also be behavioral research or health services research. And other researches are patient-oriented, no? Like drug trials or determining accuracies of diagnostic tests. No? So most of these clinical research are basically designed in order to improve healthcare. No? That is the ultimate goal of doing research. So when you develop your protocol and you're going to justify your research, make sure that your justification is along the line of improvement in healthcare. Research is the foundation, no, for improvement in medical care across time. And in fact, such improvement happened because of different studies being conducted by several generations of researchers. There are some evolving paradigms in doing research. No? Before, the initial paradigm was we collect raw data from subjects or from patients and then analyze the data and see how it can improve our future practice. One of the paradigms that is coming out is that after doing this primary research, we need to make sure that the information that we get from those primary research are translated into practice. And that is the basic focus of translating research or translational research. There is a need. This is basically done in order to enhance the adoption of clinical studies published in separate journals and apply them into clinical practice. Another type of research that is evolving is the outcomes research. In outcomes research, there is a use of real-world data, big database coming from hospital database or health insurance database. And with that information, available information, you analyze it, and then you can come up with some publications called outcomes research. Okay, so now let's go to the steps in planning to conduct clinical research. Basically, the first step that you need to do is to identify the health problem. And the health problem should usually be the source of your research idea. And this research idea or health problem can actually be an experience based on, number one, prior knowledge, your previous reading, or not only your previous reading, but maybe actual experience. During your case presentations, during hospital rounds, when you see patients, you see some good research questions or problematic health issues that can be a good research question. Of course, reading the medical literature is also another source of getting your research idea. Now, once you have that research idea, the next step that you're going to do is to convert them into a question. And the question should include this P, I, O, and M. P meaning the population, I, intervention if you're looking at a trial, a drug trial, or E, if you're looking at exposure, such as a risk factor, and O is the outcome. Letter M is the method. But usually when I develop a research idea, I first look at the PIO first. I can decide on the method later on. So here's an example of a research idea or a research question. One resident who had post-term pregnant women in the past, seen some post-term pregnant women, she was asking that among post-term pregnant women, is dinoprostone effective for the induction of labor? Then, of course, the measure of effectiveness would be successful vaginal delivery. So if this is the research question, then the next step that I would recommend is to validate your research question. Okay, and how do you validate it? You go to PubMed, and then you search PubMed using the PIO. Here, the resident conducted a Medline search on dinoprostone, plus the word induction of labor and the word and the phrase post-term pregnancy. And then you read through this yield from the PubMed, and then based on your readings, you can now decide on whether you're going to continue with this research question and what kind of design can answer this research question that might also be addressing the previous issues in the review of literature that you have just conducted. So validating your research question is basically the review of literature in your research protocol. Okay, so after that, the step number 3 is now you develop your general and specific objectives. So the general objective should be the general purpose of the study, and the specific objective must be SMART, specific, measurable, attainable, relevant, and time-bound. Okay, so we will not discuss through that, but I'm sure you have experience in doing formulating research objectives in the past. After developing your research objective, the next step that you're going to do is to decide on the study design. The design will depend on the objectives and, of course, the availability of time and funds. If, for example, you're now a third-year resident and graduating, definitely you cannot do any more of those clinical trials. Maybe a simple survey or retrospective study or meta-analysis. If you don't have enough available resources, no fund, then again, doing clinical trial is more expensive than just doing a, let's say, meta-analysis or retrospective studies, case control study using your clinical records. So you have to be you have to take care of this issue, the time, available time, and the funds. Most students prefer cross-sectional study design, and of course residents. The reason for this is because it's easy to do, and the subjects or the populations are readily available, and the data collection, the form of data collection or manner of data collection is a bit simple and it's not expensive. Now, if you're going to do a cross-section study design, it would be good to have some analytical component on it. When we say analytical component, maybe you can compare groups. Cross-sectional study, as I will discuss later on, is basically a design used to establish prevalence, but you can also do an analytical type of a cross-sectional study design. So again, my last advice, when you decide on a research design, you make sure that you consider your time constraints and, of course, the availability of funding. Okay, so these are the options for the study designs that you can do. The first is a descriptive study design. This is very simple, easy to do. Of course, it depends on your department. It depends on your training program if a simple descriptive study is going to be applicable. Descriptive studies are still very much helpful in terms of health research. Descriptive studies are the ones used to establish prevalence. So a simple descriptive cross-sectional study can establish the prevalence, let's say, of low back pain among medical students who go on duty at the emergency room, or the presence of stress at work among resident physicians. So you can do a descriptive cross-sectional study of that. So it establishes the prevalence of work stress related conditions. Case series and case reports are also descriptive study design, and I think the recent policy of the PAFP, we are also accepting case reports as a research project by the resident. Because of the COVID, we are aware that generating primary data might be difficult, no? Because of some limitation in face-to-face encounters with patients or with subjects. Aside from being a descriptive study design, you can also use an analytical type, no? And analytical type can be an experimental or observational. In experimental, you give interventions. So the good design or the best design for an experimental study would be a randomized controlled trial where we will discuss the details later on, or a quasi-experimental studies. Quasi-experiments can be an uncontrolled or non-randomized trials. Observational studies like cohort or case control or analytical cross-sectional, as I mentioned earlier, are the designs used to establish risk factors. So we will discuss all of these designs and how to do it in the next few slides. Okay, so after developing your research objective and now you have your research project, you now have an idea of the research design that you're going to think. Prior to continuing the development of your protocol, evaluate your research project first, together with the design, with the word finest. Okay, finest stands for feasibility, interesting, novel, ethical, significant, and time-bound. Is it feasible? Can you do it within your time frame? Is it interesting? Are you going to contribute new information? Is it ethical? Are you not putting your patients at risk? Or are you not, if it is a survey, are you not asking for some very personal questions? No? Significant, and then of course it has to be met by your timeline. Okay, so if the finest evaluation is okay, then you can move on in developing your research protocol and doing your research project. Okay, so how do you describe the research design? It's usually in the first paragraph of the method section, no? And usually you can add, in the first paragraph, you can develop 1 or 2 sentences for each. So what are the subjects that you will include in your study? What are the variables that you're going to decide to collect? And what are the manner, or what's the manner of data collection, and how are you going to analyze this data that's going to be collected? So with this 8 to 10 sentences, then you have a 1 paragraph to describe your research design, and that should be the first paragraph of your method section. All right, so what are the potential research design that you can use? So as I mentioned earlier, the new policy of the PAFP is that we are also accepting clinical case report as a research project. So a clinical case report is a written account of what happened to a patient. How was the patient diagnosed? What was the problematic items in the patient? Why this case report was interesting, and then how was the patient treated? So this is a reason for conducting a case report. It can be adverse event or a beneficial effect of a certain intervention. It can be a new disease or recognition of a new disease, or it can be an unusual form of a common disease or presentation of a rare disease. So all of this can be an interesting case report and therefore would be acceptable as a research project. So how do you do a case report? First, you identify a problem. So here's an example. Again, this is an obgynecology example. A pregnant woman previously diagnosed with spina bifida during her childhood grew up. She was subjected to surgery before, but she grew up normally and is now pregnant. So it's a pregnant woman who had the spina bifida correction, surgical correction in the past. Can she deliver, or can she move forward to a healthy pregnancy and deliver vaginally? So the resident look at the Medline search on spina bifida. Then she look at what are the prenatal care necessary, focusing on clinical trials. And then she reviewed the information that she obtained from this review. And then based on the review, she developed a summary recommendation on what kind of prenatal care can a woman, or should a woman with spina bifida, pregnant woman with spina bifida, should receive, so that eventually the pregnancy will be a successful pregnancy. Okay, so when you develop a case report, this is the guideline in doing a case report study, CARE guidelines, no? Consensus-based clinical case reporting guideline development. You can download this for free in the internet, and in the second or third page of this article, you will see the outline on how to write a case report. And you just follow that outline and submit your case report for as a research project and as a, or for publication. Some caution, no? We have been receiving case report, but the case report that we're receiving is not following the CARE guideline. No? The case reports that we're receiving are the narrative presentation that you gave during your conference. No? So that is not the way on writing, no? Of writing a case report. So please obtain these CARE guidelines and use it as a pattern for writing your case report. Okay, after the case report, here's another study design, and this time it's a cross-sectional study design. In a cross-sectional study design, instead of collecting data from a single patient, you now collect data from several subjects or a group of patients. Hopefully, this group of patients is randomly selected from the population. So after random selection, let's say your sample size is 30, you select 30 patients or 30 subjects from the population, then you collect the data either using a questionnaire or interview, and then analyze the results of the data, and then come up with some table to present the results. So in this type of study design, you collect the information at a certain point in time. Okay, so here's an example of cross-sectional study design. A school nurse wants to determine the prevalence of unhealthy behavior among high school students. So she developed a questionnaire on sedentary lifestyle, smoking, alcohol, exercise, and everything. And she identified that all high school students where she is working as a school nurse will be asked to respond to a one-page questionnaire. She identified the variables to be collected in that questionnaire, and then after administration, it included initials of the respondents, the age, the sex, the year level of school, and then studied all of this information, analyzed all of this information, and then presented it as a result. So the data collection is a self-administered questionnaire. And the result was presented this way. So there is a descriptive, the prevalence of smoking, it's 45 out of the 200 students that were surveyed. So it's about 22.5% prevalence. And then, of course, the alcohol drinking, which was about 7.5% prevalence of smoking. Alcohol drinking. So establish a prevalence of unhealthy behavior as far as smoking and alcohol drinking is concerned. As I've said earlier, you can do an analytical type. No? So if you want to convert this cross-sectional study design into an analytical type, you will just divide your population into subgroups. No? So what the nurse did was to divide the population to the junior high school, meaning first year and second year, and the senior high school, or third year and fourth year. Right now, it's different na nga pala. No? It's already the K-12. No? So between the junior and the senior, she differentiated the prevalence of smoking. So among the juniors, prevalence was 22.5%, but among the seniors, it was already 45%. For the alcohol drinking, 7.5%, and among the seniors, 15%. So this means that this information, it suggests that as a school nurse, she should now focus on an intensive behavioral counseling to the senior students. No? Rather than the juniors. Okay. Now, of course, you can use this to analyze your data, this statistical test to analyze your data. It can be the mean, standard deviation, or chi-square and percentage for the descriptive. Okay, and the guide for writing a cross-sectional study is called STROBE, Strengthening the Reporting of Observational Studies in Epidemiology. This is also available in the internet. You can download it for free, and on page 2 or page 3, there's an outline. So you just follow the outline when you write a cross-sectional study design. The next type of study design is a case control study. In a cross-sectional study design, you will not be able to clearly establish a risk factor or a prognostic factor. You can only establish an association, but causation is not usually established in a cross-sectional study design because of some temporal issue. The temporal issue is that in a cross-sectional study design, you collect the information at the same point in time. However, in these new types of studies like case control and cohort studies, the information or the associations of the informations or variables are collected at different points in time. Here's an example. Here's a diagram on how to do a case control study. So you have your population, you have a group of patients, and then you identify the cases, meaning those who have the disease or have the outcome. And then you also identify the control, those subjects or patients who do not have the disease or the outcome. And then you ask them, 2 years ago, 3 years ago, did you have this particular risk factor or prognostic factor? The same thing with the control. You ask them, 2 years ago or 3 years ago, did you have this particular risk factor or prognostic factor? Or you can look at medical records. No? If the present condition is that the patient is now diabetic, then you can look at the medical record if there was a history of obesity in the past. No? And that is, of course, trying to establish the association between obesity and the development of type 2 diabetes. Okay? And you also do that among the controls. So those patients without diabetes, and then you also look at whether they were obese 2 or 3 years ago. All right? So here's an example of a case control study. A resident wants to determine if having a multiple sex partner is a risk factor for the development of genital wart. So what she did, again, OB case, what she did, or gynae case, what she did was those patients consulting at the department, at the clinic, and diagnosed to have genital wart, and she selected those controls in consulting at the clinic, but was not diagnosed or did not have any genital wart. And then she collected the variable, so age, sex, and history of multiple sex partner 2 years ago or 3 years ago. Right? And then they collect the data and analyze the data. Now, in a case control study, this is how you're going to analyze it. Right? So those patients with genital wart, which are the cases, you ask them backward in time, who among them had multiple sex or partner 2 or 3 years ago. So whether they had history of multiple or just a single sex partner. And then the same thing with those patients who do not have genital wart but just consulting at the OB or gynecology clinic. Then you also ask them for the same exposure like multiple sexual partner. And then with this data layout of 2 by 2, you'll be able to get the numbers in percents. And then of course the chi-square, or in a case control study, you can compute for the odds ratio. Okay, so odds ratio, we will discuss that maybe in another session on data analysis. How do you write a case control study? You also use the strobe, as I mentioned earlier, for cross-sectional study design. The next type is a cohort study design. The difference between a case control and a cohort is that in a case control, in a cohort study, you observe with them patients forward. In a case control, you observe them backward. You ask for their history in the past, whether they have the exposure. In a cohort study, what you do is you get a population and then you look at those patients who are exposed, meaning those patients who have the risk factor, and compare them to those patients without the risk factor. And then you observe them forward in time if they will develop the disease or the outcome. The same thing with those who do not have the exposed. If there is an association between the risk factor and the outcome, then those patients who have the risk factor should have more outcomes compared to those who do not have the risk factor. Now, of course, one of the disadvantages of this study design is that there is a lag time. There is a period that you need to wait for the outcome or the disease to develop. So sometimes doing a prospective cohort study might be difficult during your training or during your professional life. Okay, so here's an example of a cohort study that was somehow realizable No? So gestational diabetes is now common. No? It's defined as any degree of intolerance to sugar during pregnancy. Now, if you have GDM, gestational diabetes, some of these women are predisposed to to having large baby, and some of them will develop complications during pregnancy. So if you want to know what are the potential complications of pregnancy among GDM compared to those without GDM, then you can do a cohort study and then identify, among the GDM patients, you identify during delivery what happened to them, whether there are complications or none. The same thing with those normal women. You also move forward upon term and upon their delivery, and you determine if there are complications during delivery, not only to the mother but also to the baby. So after observation of 6 months from the time that the OGTT was determined, then what happened to the pregnancy is the outcome that you want to observe. And this is the layout. No? One of the outcomes that the resident was interested is that are GDM high risk for cesarean section. No? So that during prenatal, if your patient was diagnosed to have GDM, you can already advise if they are at high risk for developing cesarean section. So here's a cohort study. Those that are positive for GDM and negative, and then the resident observed them forward in time. So how among them had a cesarean section during delivery, and who among them had a normal? For this, you can also compute for the odds ratio. Okay, so that's a cohort study. And the cohort and case control studies are a study design used to establish the risk factor or prognostic factors. And then, as I've said also, for cohort studies, the STROBE is also the standard for writing a cohort study design. Okay, now the next type of studies are the experimental studies, and one of the design under the experimental is the randomized controlled trials. In randomized controlled trials, subjects or patients with the disease are randomized to two groups. One group received the treatment, the other group were the control. They do not receive the treatment, and then they are observed for the outcome, which is either cure of a disease or the clinical outcome, like adverse event or maybe even mortality in the future. So randomized controlled trials are designed to determine effectiveness of drugs or interventions. Case control and cohort studies are study designs used to establish risk factors or prognostic factors. So this one is for effectiveness of intervention, the randomized controlled trial. So here's an example of a randomized controlled trial. Again, OB-gynecology example as an induction of labor. So among patients who are post-term pregnancy, this is our example question earlier, a resident would want to compare dinoprostone with a Foley catheter for induction of labor. So what resident do is that all post-term pregnant women, meaning at least 41 weeks AOG, they are randomized into two groups. After asking for informed consent, randomized either to receive dinoprostone gel or Foley catheter. And then after 24 hours, the patient is observed for whether the patient had labor by NSD or by cesarean section. And then, of course, the other clinical and clinical data are being monitored during the labor to observe whether dinoprostone has some side effects. And when you do a layout, this is the usual data analysis layout for a clinical trial. So those patients who received dinoprostone gel, and then those patients who were given or whose Foley catheter was inserted. And then they measured how many had normal delivery and then how many had cesarean section. For a clinical trial, an odds ratio can be computed as well, but most statisticians would also look at the risk ratio. But actually, these are interchangeable, except that in case control studies or cross-sectional studies, the odds ratios are more preferred. In clinical trial or prospective studies like cohort studies, risk ratio can also be used. Okay, so the guide for reporting a randomized controlled trial is called CONSORT, Consolidated Statement for Reporting Trials. So you can again look at the second page or third page of this article and you will see the outline on how to report a clinical trial. All right, so after deciding your research design, the next step that you're going to do, or the next paragraph in your method section, is the definition of your study population. So the definition of your study population is that should be specified in the inclusion and exclusion criteria. Okay, so based on the definition, you enumerate the inclusion criteria, and then you also enumerate the exclusion criteria. Now, here's one advice that I here's one pitfall that I usually see among residents. They state the exclusion criteria are statements that are opposite inclusion. That is not so. No? So exclusion criteria or excluded patients should be those patients who fit the inclusion criteria. So they fit the inclusion, but you would rather exclude them because they may not contribute the data or accurate data. Okay? So aside from defining the population, the inclusion and exclusion, you should also define when and where the population will be recruited and how they will be selected from the study population. So you should also describe that in that 1 or 2 paragraph on defining the population. After defining the population here's an example of the inclusion and exclusion criteria. No? So patients consulting for hypertension at the Family Medicine Clinic of PGH from January, and then to be included, these are the inclusion, then the exclusion. No? So excluded are those with psychological or mental health problems or those with history of allergy to the study drugs. No? So if you're giving medications, so those with allergy to the medication will be excluded from the study. All right. So this is an example of an inclusion and exclusion criteria. And next question is, the next paragraph should be data analysis and sample size. No? So in sample size computation, I'm usually recommending StatCalc in FEInfo. No? You can use the StatCalc for computing, depending on your research design, a survey, cross-section study, or prevalence study, or a case control or cohort study. So you can use StatCalc in FEInfo for that. The information that you would need would be first the effect size, the hypothesis or hypothetical odds ratio. And you usually get this from previous studies or from your literature review. You should also set your p-value, which is usually at 95% confidence, or a p-value of 0.05. And then, of course, you also set your beta, which is usually 80%. So all of these things, these 3 elements will be asked whenever you do sample size computation. It will be asked in any software, and you will fill it in. No? All right, so after that, after computing for the sample size, you know how many subjects that you would need. The next thing to do is to describe your sampling. Are you going to do random sampling or just purposive sampling? In purposive sampling, you just include the patient whenever they're available. No? But in the random sampling, you randomly select from these patients. Random sampling can only be done if you have an existing list of potential subjects or potential participants. And then you can divide this list by a sample size needed and then randomly choose the person. For example, you have a list of 300 patients or 300 subjects available, and then your sample size computation is only 50. So 300 divided by 50 is 6. So that means that every 6 in that list is going to be selected. So 1, 7, 13, 19 will be included in your patient subjects for inclusion. Okay? After computing for sample size and deciding how to randomly select from your population, the next thing that you need to do is to develop your data collection form. But of course, before you develop your data collection form, you need to identify the study variables that you're going to collect. The study variables are data that you need to collect from your patients in order to answer your research objectives. So these are the common types of data variable like age, whether the patient has disease or not, social status, and then of course some laboratory level. So these are the common variables that is in the data collection form. So you have to define that. Okay. So variables can be categorical or numerical. And again, it's important that you develop or categorize these variables because the statistical analysis that you're going to use will depend on what type of data you're dealing with. So for categorical variables, these are the nominal. No? Male, female is a categorical variable. An ordinal variable is a rank order. So mild, moderate, severe is an ordinal variable. And when you analyze them for nominal variable, you just use chi-square. For ordinal, maybe you can use a non-parametric test. Okay. Now, other variables are the numerical variables. No? So this can be discrete or continuous variables. Continuous variables can be interval or ratio. So interval has no absolute zero, meaning the zero is still a value. It doesn't mean that zero does not exist. For example, temperature. A 0 degree centigrade is a 0 degree centigrade temperature. There is a -1 and there is a +1 degree centigrade. No? So 0 is a temperature by itself. It doesn't mean that 0 is an absent value. No? A ratio is a continuous variable where 0 is an absolute value. For example, blood pressure. Systolic blood pressure. If you're dead, you don't have any systolic blood pressure, so your systolic blood pressure is 0. Okay, so it's an absence of pressure, but in temperature, 0 doesn't mean that you don't have temperature. Your temperature is 0 degrees centigrade. Okay, so that is how you distinguish the two. And again, this is important because when you analyze data, it depends on the kind of variable that you obtain. So again, I would say that for nominal, you use chi-square for analysis. For ordinal variables, you use non-parametric tests. The same thing for discrete data, counted as a separate yes or no, or number of children in the family. So there is no such thing as 0.5 children, right? So you cannot consider that as a continuous number. Here you have a decimal place in a continuous variable. Okay. So after identifying the variables, collect the data. Now, if you're collecting your data using self-administered questionnaire versus an interviewee-administered questionnaire, these are the advantages and disadvantages. No? For self-administered, there is an interviewer bias, but somehow when you develop your questionnaire, if it is going to be self-administered, it should be easy to understand. No? And it has to be tested, no? If it is valid, no? Or reliable as a self-administered questionnaire. You can also do an interviewer administered using a standardized data collection form or using a standardized questionnaire, but sometimes, as I've said, as mentioned earlier, there might be some interviewer bias. No? It might lead to fewer blank pages, no? Because there is an interviewer available, making sure that all of the questions are being responded to. But interviewer administered questionnaire are usually expensive. No? You have to hire an interviewer and you need to standardize the interview. All right, so tips for developing a self-administered questionnaire. As much as possible, questions must be clear. Choices are mutually exclusive and have few open-ended questions, no? And should be answerable within 10 to 20 minutes as much as possible. So that means you need to pre-test this, and it fits this requirement. You pre-test it to about 10 to 20 persons. Now, if you're going to do an interview administered, then an interviewer administered, then the data collector must be trained, no? And must be familiar with the data collection tools. Okay? So that that interviewer will be able to collect the data properly. Okay, after collecting your data, you're now going to do your data analysis. Well, in data analysis, first you design the software that you can use for your data entry and analysis. Most residents would prefer data entry using Microsoft Excel. For data analysis, you can use EpiInfo. No? It's a free software. You can download EpiInfo in the internet, and it's available for free. There are some statistics that you need to buy, but it's quite expensive, no? Like SAS or SPSS. It's quite expensive to buy those things. You can download EpiInfo in the internet. Prior to entering your data in Excel, make sure that you check first for completeness. No? The paper-based data collection form, make sure that there are fewer blanks. No? And then enter the database using a spreadsheet, and then before doing your analysis, after entering your data into a spreadsheet, before doing your analysis, develop your dummy tables. Your dummy tables is your hypothetical results. In other words, these are the tables that have blank data. And then you fill in the dummy table while you're doing your analysis with EpiInfo or with RevMan if you're chosen meta-analysis. So SPSS, Tata, or SAS are proprietary software that you have to buy, and they are all expensive. In your data analysis, usually you do a descriptive statistics first. You describe the population, percentages, proportion, mean, median, how many are male, how many are female, so distribution. So, and then the mean age and the standard deviation of the age. So you do descriptive statistics for the data that you have collected. And then you can also do an inferential statistics. No? So inferential statistics would now have to establish whether your population has any significant difference compared to the other population, no? Or your distribution has a significant difference in terms of distribution. For example, chi-square test, no? Or t-test for numerical, for means. And then you can also do correlation. No? So all of this can be done in your inferential statistics. No? In inferential statistics, you're doing hypothesis testing. Okay, so after data analysis, paragraph, you now go to your ethical issue paragraph in the protocol. And I think this is something that you need to emphasize in your research project. Although the policy of the academy is that it depends on your institution. Ethical issues depends on your institution in terms of approval or disapproval of your research project with regards to the ethics. From the academy perspective, we respect the institutional requirement. But from the academy's perspective, we do not require ethical approval for observational studies. If it is a randomized trial, clinical trial, drug trial, then the research committee and the publications committee would require an ethics approval from your institution. No? And of course, the ethics approval doesn't have to be the ethics review is a FREB accredited review board. No? Whatever is the ethical review that your institution recognizes will be good. Okay? So you need to have that and make sure that if you're doing a clinical trial, you do that. Now, if you're doing a cross-sectional study, survey, we don't insist or require for an IRB approval, but we want to make sure that your protocol or your final paper would have 1 or 2 paragraphs about how you address ethical issues. Ethical issues that need to be addressed should include autonomy. You should not have forced the patient to join your subjects. They should have voluntarily responded to your questionnaire and shared the data. So there should be no element of coercion. There should be an informed consent. Okay? And I'm sure you will be able to do an informed consent. So before asking for the patient to respond to a survey question, make sure that the patient signed informed consent. Okay? The other elements in the ethical issue is the technical capability of the investigators. No? Some IRB reviews would be looking for this. No? In some hospitals, if you're doing a clinical trial or a drug trial, they would be asking for a GCP certificate of at least the primary investigator. So GCP stands for Good Clinical Practice. It's a certificate on how to conduct and monitor good clinical trials. There should be some disclosure of potential conflict of interest, meaning are you getting paid by the drug company in doing this trial? This is to make sure that there is an integrity in the data collection. And of course, there should be some full disclosure of the findings. Sometimes, after doing the study, if the findings are negative, in other words, it's not advantageous for the drug, some donors, some study funders would not publish it. But of course, it doesn't have to be like that. You have an ethical responsibility to inform the healthcare professional if such drug is not effective or what, or it is giving adverse events. You have an ethical responsibility as a researcher. Okay, so these are the ethical issues, and of course that's the we're now in the last slide of my session. I hope I was able to give you some advice on how to conduct your clinical research or your research project. In summary, what we have discussed is that, why is research important? It's the backbone of improving healthcare. Second, what are the steps? So I have enumerated the steps, and then I have emphasized the different study designs that you can select. And then I also have discussed the details such as the study population, how do you collect your data, how do you select your patient, random selection, and sample size computation. And then, of course, some tips in developing your questionnaire or your data collection form. Okay, so thank you very much, and I hope you were able to get something out of this session. So good luck to your research project.